So on behalf of the World Federation of Public Health Associations, it's my pleasure to welcome you to this 15th World Congress on Public Health. The World Federation members and friends, this is a time to raise our voices, to incorporate past achievements into a vision for the future and to plan action. But 50 years ago today, a group of public health associations from across the world joined together with the intention of being more effective. What they wanted to do was make a difference. We are gathered here today to do just that, to make a difference. We can have a healthier society. Our public health predecessors have shown us the way. Our roads are safer. Our children are protected from many infectious diseases by vaccination. We have clean water, we have sanitation across large parts of the world. In parts of Australia, our smoking rates are below 10%. Women have much more control over their own fertility. Childbirth is safer. And this hasn't happened by accident. There have been many public health heroes. I would like to mention just one. The one I would like to mention is the late Basil Hetzel. Basil passed away earlier this year, and his contribution to understanding the impact of iodine deficiency was extraordinary. But he did more. He then drove the change in policy to ensure that we had iodized salt, that we had a method of dealing with it. Our predecessors have made a difference in so many ways. Unfortunately, it has not been for everyone to share in those successes. So the challenge for the next 50 years is to ensure that the advantages continue. They are not undermined, but that everyone shares in those better health outcomes. This means first understanding the social, cultural, economic and environmental determinants of health, understanding the emerging issues and their causes and the causes of the causes, as Sir Michael Marmot would say. And these include non-communicable diseases, includes antibiotic resistance, it includes the effects of climate change and so much more. But it also means working together to develop clear plans for improving health over the next 50 years. And it means delivering such plans through effective advocacy. It is no accident that the theme of this conference is Voices, Vision, Action. These are the fundamentals for making a difference. This is why we are gathered in Melbourne at this World Congress on Public Health to make a difference. Public health professionals around the globe are here, working together to get a joint direction. It's an effort that is needed to improve the public's health for the future. And it is particularly important in the context of a globalised world. Voices have been heard. Public health associations internationally, many of our international civil society colleagues and friends have not only joined us in developing this Congress, they have participated in the development of the Global Charter for the Public's Health. That charter sets out a clear vision for improving health globally. And now it's up to the World Federation, each of its members, other NGOs, governments, and you as individuals to develop action in order to implement this important vision. Voices, vision, action. During this Congress, we will also celebrate the 50th anniversary of the World Federation of Public Health Associations, and we'll do that on the Congress party on Tuesday evening and on World Health Day on Friday. The celebration marks 50 years of public health advocacy coordinated across associations around the world. And during this time, we have learnt lessons, we've gained expertise, we've become established thought leaders for addressing public health needs at local, national and international levels. And we are here to build on that knowledge and that understanding. We're here to take the baton from our predecessors and to head into the future, taking public health leadership for the next 50 years. And when I look around me, when I looked around me last night, when I look around me now, I see so many young people here. And you, the young people, I challenge you In particular, I challenge you, the young people at this Congress, to take on the leadership of the future. It's time for you to knock me and my colleagues off our pedestals. It's time for you to remove the grey beards and take over from them, and those who can't grow grey beards as well but are of the same era. Take over from us. Grasp the nettle. Get out there, challenge governments, engage with them, challenge unhealthy industries. You have the knowledge, you have the voice, you have the vision. Now it is time to take action. This is why we have developed the Global Charter, so that you can tap into our experience. This is why we have developed the Melbourne Demand for Action. The World Federation, along with all our Congress partners, have developed a Melbourne Demand for Action, which will be considered on Thursday. And you'll have the opportunity to support it. My World Federation President-elect, my successor, Professor Letitia Rispel from South Africa, will present the Melbourne Declaration to the meeting on Thursday to give individual attendees the opportunity to offer their support, which will be done by acclamation. We will ensure that that will be put on the app in the next couple of days. What we want to do is provide a model for working together. And that's what you are charged with doing, not just the young people, but all of us. The Global Congress is an opportunity for public health leaders and professionals from around the world to join together to make health a priority issue, to make a difference. It's an opportunity to use our voices to promote public health. It's an opportunity for the vision to build on the visions such as the Declaration of Alma Ata, such as the Ottawa Charter. It's an opportunity to consider current visions such as the Sustainable Development Goals, such as the Global Charter for the Public Health. And it's an opportunity to take action in the knowledge, the tools and the skills that have been developed as public health professionals to work with government, to work with industry, to work with academia, to work with civil society, to protect the public's health. This Friday is World Health Day. We celebrate on that. We also celebrate 50 years of the World Federation. It's time for us to appreciate and recognise the present, to learn from the achievements, the mistakes, the actions and the inaction of the past. We have come a long way, but in one sense, it's just the beginning. It's my hope that this event inspires you to continue in the pursuit of better health, not just better health for ourselves, but for better health for everyone on this planet.